Hi everyone, I am Dr. Radhika, gynecologist and laparoscopic surgeon, Medicava Hospital, Madhapur. Today we will discuss about menstrual hygiene. So what is menstruation? It is a cyclical shedding of the endometrium. We also call it as the weeping of endometrium. It is a natural phenomena, but in our country it is a taboo topic. It is unclean and embarrassing. Because of these myths, there are so many implications. So because of this stigma, it is causing insecurity and low self-esteem to the girls or women. And there is drop in school attendance. Even the unavailability of hygiene products are also causing increased vaginal infections. So why the menstrual hygiene is very important? Menstrual hygiene, if you don't take proper precautions, then you can have high chances of infection. It can be urinary tract infection or it can be the reproductive tract infection. Most of the hygienic products, they contain chemicals. So there are so many chemical reactions also coming which can lead to some other diseases. And there is very severe condition known as toxic shock syndrome, where the prolonged usage of the pad without removing in between then can cause to the toxic shock syndrome, where the bacteria, the streptococcus bacteria will grow and the woman can get fever, and sometimes it can also lead to multi-organ failure also. And because of the repeated infections, there is high chances of cervical cancer. And the disposal is also very important. So if it is not disposed properly, then your surroundings will become ugly, and there is chances of transmission of hepatitis B and hepatitis C also, but HIV usually doesn't transmit with this. And also your environment will become messy. So in general, the main hygienic tips which you have to take is, you have to change your sanitary pad every 6 hours and keep your genital area clean and dry. And you avoid vaginal douching, that is very important. And whenever you urinate, you have to clean your genital area and you have to take bath. So there are some myths that you should not take bath during menstruation, but you have to take bath and maintain your personal hygiene. So what are the various feminine hygienic products that are available to us? So we have sanitary napkins, we have tampons and the menstrual cup. So coming to the sanitary napkins. The sanitary napkins, they can be reusable ones or the disposable. So it is better to use the disposable ones. With the reusable ones, there will be increased chances of infection, and most of the people do not take proper precautions with the reusable ones. So it is better not to use cloths and go for the sanitary napkins. In the sanitary napkins also, they are made up of different materials. So you have to choose a sanitary napkin which is made up of non-plastic. That is very important. So the non-plastic one, you will not get certain diseases like endometriosis, and you will not be prone for the cancers. Next comes the tampons. The tampons, you sit on the toilet and then you have to know your anatomy. Where is the vaginal opening is there, and what is the urethral opening, what is the anal opening. Hold the tampon at the middle with your thumb and middle finger, and with your index finger at the top where the string is there. Insert the tampon inside the vagina and then press the thinner half of applicator upwards with your index finger. Then pull out the applicator. Check for your comfort levels. It's important to change the tampon every 4 to 6 hours. Otherwise, there will be chances of toxic shock syndrome. Then you can relax. So when you are removing the tampon, hold the string and slowly remove the tampon. It's important to safely dispose of the tampon. The next available is the menstrual cup. Menstrual cup holds much more blood than compared to the sanitary napkins and tampons. So it is a flexible funnel shaped cup. It is made up of silicone or rubber. So how to insert the menstrual cup? So the precautions are, you have to wash your hands initially and choose the right size. The size depends upon your age and then the length of your cervix, and you had whether normal vaginal deliveries or not. So choose the right size, that is very important. So once you choose the right size, you can sit on the toilet or you can insert it in the standing position or with one leg raised. So hold the menstrual cup in the middle and make a C shape or S shape, which will be convenient, and insert the cup into the vagina with rim up. So once the cup is in the vagina, then you rotate it. Then you check for the airtight seal. So once the menstrual cup is in the vagina, all the blood, the menstrual blood, it collects in the menstrual cup and there will not be any leaks. Then how to remove it? So insert your thumb and index finger and pinch at the base. You have to follow the stem up to the base, and if you pinch at the base, the vacuum gets released. Then you can pull off the menstrual cup. Then you have to pour the blood into the toilet, and then you have to clean your cup and keep it safe, keep it dry and keep it safe. Initially first 2 to 3 cycles you will feel it is little messy, but once you are accustomed to it, then you will feel the comfort. You can exercise, you can swim with the menstrual cup inside, you will not feel anything. Even now the period panties are also available, where they are made up of special fabrics and they are designed to pull blood and liquid away from the body. So the menstrual cups are eco-friendly, they are economical, and if you are having more bleeding, then they will hold more amount of bleeding and it will not be messy. Even you can exercise, you can swim. So there are various feminine hygienic products that are available. So know all the pros and cons of all the available products and use them safely. The important thing is you have to avoid plastics. So now you know them. So tell to others and you remove all the taboos associated with the menstruation. Thank you.